Do you think you might have gonorrhea, or have you recently been diagnosed of gonorrhea? Stay tuned as we talk about gonorrhea as our topic for today. Welcome to Health Matters. I am No Splendor, and today I'll be talking about gonorrhea. Gonorrhea is a sexually transmitted infection that is caused by bacterium known as Neisseria gonorrhea that affect both men and women. Globally, an estimated 78 million have been diagnosed each year, and it is the second most commonly spread STD. In 2015, it causes over 700 deaths, and this bacteria affects the moist areas of the body, including your eyes, the throat, the vagina, the penis, the anus, the cervix. Gonorrhea is commonly spread from one person to another through sexual contacts, either oral, anal, or vaginal sex. It can also be passed from mother to child during childbirth if the mother is infected. Previous infection does not confirm immunity. This means that if you've been infected with gonorrhea before and you get yourself treated, it is not guaranteed that you've developed immunity over gonorrhea. You can still get infected again if you come in contact with someone that has gonorrhea. So you can have a recurrence of gonorrhea if you keep exposing yourself to an infected person. Now let's talk about the risk factors. Factors that predisposes you to gonorrhea. Gonorrhea is common among young people, young women who engage themselves in unprotected sex. It's common among men who involve themselves with men, men who have sex with men, people who have multiple sex partners, those who have new partner that have another partner that you don't know their health status. So these are people that are exposed to gonorrhea. You have a higher risk of contracting gonorrhea. In many cases, gonorrhea does not have symptoms, but if they do, it occurs 2 to 14 days after exposure, and it affects other parts of the body, but it's mostly common in the genitals areas. Now let's talk about the symptoms in women. As a woman, how do you know you have gonorrhea? Number 1, increased vaginal discharge, painful urination, bleeding between periods. Maybe after sexual intercourse, you start bleeding. Lower abdominal pain or pelvic pain. When you start having these symptoms as a woman, know that there is sign for gonorrhea. What about the men? As a man, if you have a pus-like discharge from the tip of your penis, or you also have a painful urination, or you have swelling in one of your testicles, or redness around the tip of your penis, please run to your healthcare provider to run a test for gonorrhea. In babies, gonorrhea affects the eyes. During childbirth, the process of the child coming through the birth canal, that's vaginal birth, and the mother is infected with this bacterium, it affects the eye of the baby. What about other parts of the body? Gonorrhea also affects the rectum. It can also affect the eyes of an adult too, the throat. The symptoms in the rectum, you start having anal inching. You see some people walking on the streets, they will start putting their hand in their anus and start scratching it. You have anal inching. You have pus-like discharge from the rectum. And also, you see a spot of bright red blood that stains the tissue. Please, if you have these signs, run to your healthcare provider. And also the eyes, it causes inching. And pus will also start coming from the eyes, either one of the eyes or both eyes. Then the throat, what are the symptoms? You start having sore throat. It's common among those that have oral sex. When you have oral sex with an infected person, the bacteria will affect your throat. And also causes swelling in the lymph node around your neck. So please, if you notice any of these symptoms, go and see your doctor for a test or for a proper diagnosis to confirm this infection. What are the complications of gonorrhea? If gonorrhea is left untreated, it causes major complications, such as infertility in women. Gonorrhea spread to the uterus and the fallopian tube, thereby causing pelvic inflammatory disease. And PID causes scarring of the tube, which can lead to tube blockage. We see a lot of young people having infertility issue because some of them, one of their tube is already blocked due to untreated gonorrhea or other sexually transmitted infection. In men, gonorrhea can also lead to infertility, not only women. Gonorrhea causes a small coil tube in the red portion of the testicle where sperm ducts are located, that is the epididymis, to become inflamed. And this condition is known as epididymitis. An untreated epididymitis can lead to infertility in men. The bacterium that causes gonorrhea can spread through the bloodstream and can affect other parts of the body. It can cause joint pain, fever, rash, and other complications in the body. Then in babies, if a child contacts this gonorrhea from the mother and immediate treatment is not given, it can lead to blindness. You see some children, after birth, the two eyes are closed. So it can lead to blindness of that child if proper treatment is not carried out immediately. Untreated gonorrhea can lead to your increased risk of having human immunodeficiency virus, HIV, the virus that leads to AIDS. It increases your risk of having HIV/AIDS that is incurable. So while living an infection that can be cured and allow it to predispose you to the one that does not have cure. That is why early detection is very necessary. Once you detect, go for diagnostic test and treat yourself of gonorrhea. You will avert all these complications and the harm and the danger that it might cause, not only you but to other people. Imagine someone who refused to treat gonorrhea and later have PID, which leads to the blockage of the fallopian tube. Start looking for a child. And these are simple things that you can avert. So please, your health is your responsibility. Take note of Any little signs that you notice in your body, you as a woman, you as a man, and go for a checkup. Always check your health status. Don't even wait till you have the symptoms, because most of these sexually transmitted infection, their symptoms does not appear easily. So you go for a routine checkup. It doesn't cost anything. Now let's talk about the preventive measure. Like I said in my previous video, the surest way of averting most of these sexually transmitted infection is abstinence. But if you can't abstain from sex, use condom. Be faithful to your partner. Stop having multiple sex partner. And if you meet a new partner, make sure you know the health status of that person. Tell the person to run a test. Then once you know the both of you are free from this sexually transmitted infection, you have to stay faithful. Go for a regular gonorrhea screening, because it's a common STD. Gonorrhea can be diagnosed by analyzing samples of cells. These samples are collected by swab of the affected area, either the penis, the vagina, your throat, or your rectum, and they are taken to the lab for examination. Urine test can also be used to detect bacteria that is in the urethra. So if you feel any of those symptoms that I've mentioned earlier, you go for a lab test for a proper diagnosis. If you are tested positive to gonorrhea, you and your partner had to be treated, not one person. Because even after you finish treating yourself and your partner refused to treat, you're still going to contact it again. That is why it's advisable both partner get themselves treated of gonorrhea. So please, you can see your doctor, your healthcare provider for a proper treatment. A single dose of ceftriaxone injection can treat it very well. Or you can take oral medication, azithromycin or doxycycline. And you can possibly see your healthcare provider for a proper medical treatment. And we've come to the end of today's lecture. I believe you've learned something new today. Please check yourself. If you have any of those symptoms that I've mentioned about gonorrhea, go for a diagnosis. See your doctor. See your healthcare provider. You are responsible for your health, because your health matters. So please, if you like this video, subscribe to my channel. Share this video to your loved ones. See you next again in my next video. Thank you and God bless you.